So Mufti Abdullah, there are certain times, aren't there, where, let's say, for example, the doctors tell us that this is a very high risk patient. So, you're somebody who's got, let's say, kidney disease and very end stage kidney disease, and the patient's insisting that they want to fast. At what point as ulama can we say that it becomes obligatory on you not to fast? Now, this is a quite an important question, because I sometimes see this being used quite loosely. So I've even seen Muslim physicians even turn around to patients and say, look, it's haram on you to fast. What are your thoughts regarding that?
So that's an excellent question. It seems that the fuqaha of the whole do look at individual circumstances. And there are individuals who, at their current state, or looking at their state in the next few months or so, it looks like they will never be able to fast. Right? Looking at their medical situation. Now, perhaps the scholars did leave up that situation. Maybe miraculous recovery, or maybe there's a chance somehow or another they something will happen. There's a new medical breakthrough, and next year that person is healthy again. They're in a situation to fast. But as we know, generally, once a person is in that type of situation, at least for the next few days or so, we'll have an idea that that person will not be able to fast. Now, I think the point that you seem to be alluding to is, with certain individuals, the only way they will listen to the ulama, or the only way they will listen culturally, is if you tell them it's haram to fast. And now it makes it very difficult, because we've explained everything else to them. It's harmful to fast. Perhaps you shouldn't be fasting. It's dangerous to your health. And the super Sufi approach, and this will not listen. So perhaps there does seem, Dr. Rafaqat, there does seem to be some scope to do so, in the fact that la darara wa la dirar, and the fact that fasting is harmful for that person. Yeah. So some people, in fact, use the term harm and haram, kind of the link between the two. And there seems to be a basis that if we know fasting will, for a fact, based on expert doctors like yourself, fasting will harm that person, and the person is not listening to us, there seems to be some scope for us to tell them, in your specific situation, because if you were to fast, it would exacerbate your condition. It would lead to XYZ situations. In your situation, it would be haram for you to fast. So there does seem to be some scope to do so. I would hope we wouldn't end up in such a situation where we have to tell this person it's haram for you to fast.
And I assume when we say that, using the concept of it would be haram for you to fast, it would be in a situation where we are quite certain that that person, if they were to fast, that they would actually cause serious harm to themselves, i.e. loss of life or loss of limb, etc. So it would require us to have some level of certainty.